Hey everybody, Dr. Nuveen here with Smiles Inc. TV. On today's video, I'm going to answer a question I get all the time. Does my child need an expander? That's what this is. Stay tuned to find out. Okay, so expanders were designed to expand the upper jaw. And they are specially designed to fit in the roof of the mouth like this. Just like this. They attach to the back molars, and then there's some special parts that run across the roof of the mouth like that. And basically, the upper jaw is made up of two bones, and the job of the expander is to push those two bones apart and widen the upper jaw. Now, over the years, what's happened is a lot of orthodontists and dentists that do braces have used the expander to try to create space for teeth that don't have enough room. That's not the original intention of this device, and it's actually not a good way to straighten teeth. While the expander works very well to widen the upper jaw to fix certain types of bite problems, one of which is called a crossbite, where the upper teeth are biting on the inside of the lower teeth, that's a perfect situation where you would use an expander. Otherwise, if the upper jaw is super narrow and it really needs to the shape really needs to be changed into a wider form, that's another reason you would use an expander. But generally, you would not use an expander to fit teeth in that wouldn't otherwise fit in the mouth. Because, according to a study done in 2006, I can't remember the number of patients, but tens of patients were taken through a study where they were given an expander followed by braces, and then 6 years after the braces came off and after the expander was removed, they measured a bunch of different measurements of the teeth. Over time, the expander only provided about 4 millimeters of space in the upper arch. And when I say upper arch, I mean in between the upper teeth. And they measure from the front of this molar to the front of this molar. So all the way around here, the expander created 4 millimeters of space. Now, 4 millimeters is really small. It's not even maybe half the width of this center tooth, and it's certainly not going to make a huge difference in a patient whose teeth is completely really crowded and crunched up. So, does my child need an expander? Yes, if the upper jaw is so narrow that they're biting on the inside of their bottom teeth. Yes, possibly if the upper jaw is pathologically small, but not necessarily if it's just putting an expander in for space to fit teeth in, because the expander only creates about 4 millimeters of space. All right, hope that clears it up. Thank you so much for listening, and I'll see you in the next video.